Well, to give a clear answer, I don't think that we know exactly what the relevance of that at the moment will be, because in general, patients who are resistant to platinum are doing very poorly. And so when I look at the literature that has been reported, then I would say that about these people have a life expectancy of about 100 days. So that's really very limited. And so every gain that we would have would be important. What we have learned from several studies with cetuximab alone is that you have a possibility that you will increase survival by about 2 months. That's not from randomized trials, but that is from single phase 2 trials. And that is fascinating itself because the toxicity of cetuximab is not very high, so the patients are tolerating it very well. And what we found in these previous studies was that they had a response rate of about 10%. In this trial, again, about half of the patients had benefit, but you saw a higher response rate, around 20%. So that is in itself interesting. Well, I think we're talking about two different groups of patients. In the extreme study, patients that were never treated for recurrent metastatic disease went into that study. They may have had chemotherapy or radiotherapy for their primary treatment, but they were treated for the first time for their recurrent and/or metastatic disease. The patients in the extreme study, we expect that the survival benefit in general in that group of patients is 6 to 9 months. And what we learned from the extreme study, where platinum 5-FU was combined with cetuximab versus a group of patients that only received the chemotherapy, was that we found survival benefit. So the survival in the control group was 7.4 months. And it went up to 10.1 months. So that's a significant and worthwhile increase in survival. And the response rate was also, I think, very clearly better than in the control group. And that is of benefit for such patients because if they have symptoms, if they have complaints of pain or shortness of breath, you have a higher chance that that will be diminished when you give this combined treatment. So I think on the one hand, to answer your question, you cannot compare these two trials, and the value of the extreme study is that patients live longer, that their quality of life is not negatively influenced, and that they may have a reduction of symptoms in a higher percentage than when you give the chemotherapy alone. Well, it's more or less what I already mentioned to you. I think that this was a large trial, so we had 442 patients in that study. So there was an adequate number of patients to be able to judge whether there was a difference in outcome. And it was quite daring, I think, because we had for 20 years never a form of treatment that was better than the chemotherapy alone. So this is the first time that we see that there is an improvement in survival. So in that sense, I think the extreme study was a very interesting study. Well, the answer is yes, because of every benefit that we will find in a population like patients with recurrent metastatic disease is of importance. So when you finally find something that is better than what we have used for all those years, then it is most likely that that will be a form of treatment that a lot of people will consider as a new sort of standard treatment. Yeah. Well, to be honest, this is something that is worrying me a lot. I mean, we have over the past years treated patients with head and neck cancer more and more aggressively. And we have learned also that when we look at the toxicity data, especially the late toxicity data, that quite a lot of patients are suffering from the fact that they cannot swallow very well, that sometimes they cannot eat adequately, and when they are able to eat, then they can only eat soft food or fluids, and sometimes even a small percentage of patients need a feeding tube. And that is not a nice way to live. So if we can have our improvements without increasing the late toxicities, that would be extremely important. So I think we have to find ways whereby late toxicity is going to be reduced.